Hello and welcome today to our webcast. Our entitlement today is Uniquely You, Eating Well and Living Well. Today, I'm Dr. Rebecca Arend and I'm a GYN oncologist at the University of Birmingham. I'm going to be the moderator. We're going to start our structure today with an 8 to 10 minute PowerPoint video, and then I'm going to introduce the rest of my moderators. So here's our today's agenda. We're going to start with the body and nutrition exercise mindfulness, and then stretching activity, followed by a Q&A panel, followed by a mindfulness session, another Q&A panel, and finally, I'm going to give you some information on additional resources.
Welcome to Uniquely You, Eating Well, Living Well. This is the 7th session in our Uniquely You series. Thank you for joining us today. Optimal self-care is essential for healthy living. This is true whether you are newly diagnosed, going through treatment, or in survivorship. In many ways, you can proactively and positively impact your quality of life, and in some cases, improve your chance of survival. Making good food choices, avoiding inactivity, and maintaining a healthy mindset are 3 ways your day-to-day decisions influence your overall well-being. Each aspect is important. The end goal is to strive for balance. In today's webinar, we will examine the body and see how nutrition, exercise, and mindfulness can help you live better during your journey. The journey to healthy living begins with the mind. It all starts with a plan. Strive to make a list of what items to buy before you go to the grocery store. Commit to an exercise routine. Look up an app that helps you focus on calming thoughts. After a while, your mind will become accustomed to everyday habits. There are a number of advantages to eating purple, red, yellow, and other colored foods. Include them as a part of your everyday diet. Keep them in the fridge. Take one with you on the way to work, or add them as a side to any meal. Colorful plant foods contain powerful nutrients called phytochemicals. These help fight cancer, heart disease, and other illnesses. Positive messages reduce stress and anxiety. You are a beautiful human being. Listen to messages that remind you of that every day to keep you moving forward. When you wake up, write down 2 things you are grateful for and speak them out loud. Making this a routine will help to retrain your thoughts with intentional thinking. Finding the good can influence how you face each new morning. Studies show thoughtful breathing helps survivors with chronic pain, stress, and anxiety. Studies also show yoga helps fight fatigue and depression in survivors. You will be able to breathe healthier if you avoid cigarette smoke and vaping. Survivors who exercise regularly have lower risks of heart disease. Mediterranean and DASH diets are also linked to reduced heart disease. Obesity increases risks of both heart disease and cancer. Obesity and high body mass index are directly linked to endometrial and ovarian cancer. Exercise reduces risks and improves survival for several cancers, including ovarian and endometrial cancer. Eat small meals every 2 to 3 hours. Weigh yourself at least once a week and keep a record to watch for trends. When hunger strikes, be ready with healthy foods or snacks that you enjoy. Lift a soup can in each hand twice a day and help strengthen your muscles. You can also use your hands to measure serving sizes. 1 fist is a cup of rice. 1 thumb is an ounce of cheese. And 1 palm is a 3-ounce serving of meat. Dancing. Do it alone or with your partner. It's all up to you. Try different types of dance or movement. Breast cancer survivors of all ages and physical abilities saw a positive effect from moving in harmony with their partners. Chiropractic care, acupuncture, and meditation are non-traditional methods that are gaining popularity and may be used more commonly in the future of cancer treatment. As alternative therapies, these options help improve cancer care by decreasing pain, insomnia, and fatigue. These therapies should be discussed with your medical team first and can be an integral part of your treatment plan.
Thank you. So first, I just want to say to the audience, and this is something that I say to all my patients on a regular basis, is that cancer treatment is more than just radiation and chemotherapy. It's looking at well-being holistically, and that means nutrition, that means movement. And so before we get into our question and answer portion, I would love to introduce our yoga instructor, who is an attorney, and she has a master's in public health and certified yoga instructor, Justine Farinoff, who's going to start us off with a 2-minute live hair stretch session. Thank you, Justine.
Hi, everyone. So nice to see y'all. Hope you're enjoying the session thus far. Just a little note about setting up for our time together. If you have a yoga mat, I suggest always keep it unfolded in a practice space. Don't keep it in the car. Don't keep it stored in your closet. Set up a little space for yourself and put a plant there, maybe a candle, a blanket, a towel. Have your sacred space ready, and inviting space is going to call you in and let you know that it's time to practice, and everything will be set up. So what we do, we'll have either the option of being seated on the floor or seated in a chair, and this is going to be very gentle and accessible for almost every kind of body and body experience. What I want you to do is just to take a few moments and start to come into your own physical awareness. Take a look at your hands, at your feet, and we can bring our awareness all the way down into our feet. Just look at the feet and gently stretch through the toes and feel through the soles of your feet a very soft spread. And when the mind is racing and when we feel a little bit overwhelmed, it's really nice to bring the awareness down into the feet. If you're seated in a chair, you can press your feet into the ground and feel that connection to earth. Start to feel into the body, and we'll work with the breath very gently, inhaling through the nose, soft exhale out through the mouth. We're not forcing or manipulating the breath in any way, simply bringing our awareness to the flow of the air cycle in and out through the nose. And we'll start our gentle practice with a twist. This is a really simple, soft twist. Twisting to the left, you can bring your left hand behind you. The right hand can simply rest on your legs, and feel the relationship now between your shoulders and your pelvis. Feel your pelvis anchoring you back a little bit to the right as your spine twists gently to the left. And then feel the relationship between your chin and your skull. We're going to turn the chin really gently over to the right, and then very softly let the chin lift up towards the sky. You'll feel a gentle stretch through the back side of the neck, upper left side of the neck. Let the chin relax back down. Bring your chin back to the midline of your body, and we'll do that again. So staying in the twist of the spine, Chin moves over to the right. Pause, take a soft breath, inhaling and exhaling. The eyes can be opened or closed, whichever one feels best for you. Chin up towards the sky. You'll feel a gentle stretch through the back of the neck. Chin down. Chin back to the central line of the body and releasing that twist. And just pause for a moment. You can take your hands and just let them rest on your thighs. This is really gentle work. It's softening and stimulating for the lymphatic system, which runs very close to the surface layer of the skin, just bringing some gentle ease into the body while we stretch and move. We'll go to the other side now. So twisting now to the right. This left hand, just let it rest wherever it falls, in your thighs, in your lap. Feel into your spine. You can spread a little through the toes, reconnect all the way down to the soles of the feet. As you twist the spine to the right, feel the hips organizing you back to the left. And then on this side, we gently turn the chin to the left. Bring the chin up softly towards the sky. You'll feel this upper right side of the neck, gently stretching. Bring the chin down. Return the chin to alignment right above the spine. Take an inhale through the nose. This time, exhale softly out through your mouth. Chin turns to the left. Chin up towards the sky. Feel that soft stretch behind the neck. See if you can relax a little bit of tension through the jaw, through the shoulders. Chin comes back down. Chin back to center. And then gently releasing the twist. Your hands can rest once again on your thighs. And just roll the shoulders a few times. Feeling that soft breath through the nose, inhaling through the nose. You can either exhale out through the mouth or exhale out through the nose. It's your choice. Go the other direction with your shoulder rotation. Softly feeling the shoulders move along the back, up towards the ears, and rotating down towards the earth. Soft breath as you move. Inhaling through the nose, exhaling softly either through the nose or through the mouth. And just letting your shoulders rest. And one more stretch, gentle for the spine. You can let your hands rest softly on your thighs. And we're just going to now stir the spine in relationship to the pelvis. So this one should feel really nice. You can make the movement small. It's your choice how big the movement is. Just stirring the spine in relationship to the pelvis. Feeling that soft inhalation and exhalation through the nose. Go the other direction, stirring the spine. Relaxing through the jaw as you move your spine in relationship to your pelvis. One more rotation. And then pausing in center. And just letting the hands rest back on the thighs. You can spread a little bit through your toes once again. Feel the length of your spine. Feel the skin softly resting over your bones. And then you can go on with your day.
I hope everybody feels as relaxed as I do. That was amazing, Justine. Thank you. Okay, now we're going to move into the question and answer portion. And I'm going to invite two of our other panelists to join us in this portion in addition to Justine. We have Dr. Rogers, and she's internal medicine and obesity. She specializes in physical activity at the University of Alabama. And we have Luz Chavez, who's a certified specialist in oncology nutrition specifically. So we're going to welcome them to the next section. And we really want to take this opportunity to talk about not only the power of movement, but as well as eating and eating for really mindfulness eating, wellness eating, and some of the current sciences around these topics. So we want you to join us by putting questions into the chat as we look at supplements and vitamins and exercises and dietary approaches and complementary alternatives. And in addition, I hope everybody received the recipe that we sent out with the link. So please feel free to enjoy the lunch recipe that was sent to you and continue learning with us. So after we do the Q&A panel portion, which I'm going to lead, we'll do one more mindfulness exercise with Justine, followed by a question and answers from the audience. So the first question I want to direct to Luz. So Luz, frequently people ask, is there anything I can eat to prevent my cancer from coming back? They want to know what makes a healthy, balanced diet? What are the benefits of eating certain types of foods? Can you help us answer that question?
Yeah, so first what I'll say is that for the prevention of cancer, it's not necessarily just about diet. It's actually, a few different things. And I always refer to the American Institute for Cancer Research when it comes to cancer prevention and a lot of other recommendations, because they've actually put out what they refer to as like their blueprint to beat cancer. And it's actually a group of, 10 diet and lifestyle recommendations to reduce the risk of whether it's recurrence or even just preventing cancer. And, I would encourage everybody to refer to their website for the full details. But, to summarize it, at least today, they place a large emphasis on a plant-based diet, to at least give you an idea in terms of serving sizes. When it comes to fruits and veggies, you want to include about 5 servings per day. And I'll say that that's probably the minimum. Some people will definitely eat a little bit more, especially if they do enjoy a variety of fruits and veggies, but, at least 5 servings per day. And then the other emphasis is also just variety of whole grains, versus simple starches, like things that are made out of flour, for example. And then even things like beans, nuts and seeds, and just making sure that you're including a variety of all those plant-based sources. The other thing that's also very important is making sure that you're drinking plenty of fluid. Minimum recommendation, I would say, is 8 cups of water per day. However, I will say that fluid recommendations are definitely weight-based. So it never hurts to speak to your local oncology dietitian or your oncologist to make sure that you are adequately hydrated. And then you also want to focus on lean protein sources. In terms of preventing cancer from coming back, we do know that, a lot of red meat is not necessarily good, especially for certain cancer types. It can definitely increase your risk. So we want to definitely recommend things like seafood, poultry items, lean red meat. And in terms of foods that you want to actually avoid or limit, you want to make sure you're limiting and avoiding fast food, processed foods, which fast food kind of falls under that, and then sugar sweetened beverages, and even just added sugar. These things we want to reduce it down to a monthly basis if possible. What I will say is that, if your diet currently does consist of quite a few of these things, don't worry, speak to your dietitian and he or she will kind of help you kind of adjust your diet in a gradual manner so that it's not such a shock for you, so that, this seems a little bit more attainable for you. But if you're looking for more information, I definitely would recommend going to the AICR, or the American Institute for Cancer Research website, and they definitely elaborate a lot more in all of these points that I've just touched on.
Great, thanks. And yeah, we're going to provide everybody with these resources at the end, so you'll have access to them all. We also know that the American Institute of Cancer Research states that 3 out of every 5 new cases of endometrial cancer are preventable with physical activity. So 30 minutes per day, and by maintaining a healthy body weight, a BMI of 18.5 to 25. Additionally, people engage in moderate physical activity during cancer treatment have a lower amount of anxiety, depression, nausea, fatigue. So I want to direct the next question to Dr. Rogers. The question is, how much time should I spend with physical activity? Is it safe? When can I start with physical activity? And is it okay to do during treatment? And how soon can I do it after surgery?
So that's a great question. Thank you so much for that. So in general, it's recommended by the AICR as well as other organizations, including the American Cancer Society and the American College of Sports Medicine, that the cancer survivor engage in at least 150 minutes of moderate intensity aerobic exercise per week. You actually get 2 minutes credit for every 1 minute of more vigorous exercise. So if you're doing more vigorous, then the recommendations are at least 75 minutes of vigorous. But this is not the only type of exercise that's recommended. It's also recommended that you do resistance training twice a week, as well as regular stretching exercises and balance exercises. So the exercises that have been most closely linked to the risk of cancer either occurring or recurring is the aerobic exercise, but the other types of exercise are very important for helping you maintain your physical functioning over time. So the American College of Sports Medicine does have a set of resources on their website. It's called Moving Through Cancer. A lot of resources both for you and your oncologist are for physical activity after cancer, and I would recommend that you certainly visit that website for more information. If you're wondering what is moderate, what is vigorous, so well, an easy way to determine that is if you're doing moderate intensity exercise, which is like a brisk walk, then you're able to talk, but you're not able to sing. And if you're doing more vigorous, which is more of a jog or a run, you're going to have a little bit of trouble even talking at that intensity. Now, how much should you do? I mean, that's the goal, but if you're not doing any exercise at all right now, it's important to start slow and gradually work your way up. And if you're having physical limitations that you're struggling with, then talk to your doctor. Maybe they can refer you to physical therapy to help you develop a program that may be safe for you. But the important thing is to do more than you're doing now and do it gradually increase that over time.
Great. Thanks so much. And then this is for Justine. The question is, do I have to work out? What if I only do stretching type activities? Does this count as physical activity? Anything I can do with an online group at home, using a chair, which you showed us, using a wall? Are there types of like 5-minute stretches, which clearly we're learning today that I can actually do? Any advice on that, Justine?
Sure. So what's amazing about the current moment is that so much has opened up in terms of accessibility. So for many people, when I say, I teach yoga and I offer meditation, they say, "Ooh, I can't touch my toes," and that's kind of the first thing. I want to do yoga, but I can't touch my toes. And I say, well, we've got all sorts of props. I've got props here. We've got props that we can use. So you don't have to touch your toes. You bring the floor to you. And so I would say, find a skillful teacher, whether it's in your community, if it's online, if it's through a book. This is one of my favorite resources. This is Judith Hanson Lasater. Got this from the public library. This book is called Relax and Renew, Restful Yoga for Stressful Times. She's a PT, a physical therapist. And this is a beautiful resource, a very rich tool. I have a number of her books. Reach out in a way that feels right to you. And know that this is a stressful time, and so you may or may not want to go out into the community. You may want to bring the community to you. So in your neighborhood, I trust that there are yoga and mindfulness teachers. I would suggest working with somebody who has a good understanding of anatomy and physiology, and also somebody who perhaps has experience working in the space of accessibility. Something that can happen as we age just naturally is our bodies change, right? So the way that I feel today in my mid-40s is quite distinct from how I felt when I first started practicing in my late teens. And so the physicality and the intensity that I found quite attractive earlier in my life, I'm not so into that anymore. I still like to really work my body and feel my body move. I love in the video that reminder to dance. I usually do include dance moves in my yoga practice and in my teaching and in my own life. And so knowing that where we are in our life changes and shifts, and to be flexible and to change and to adapt is going to help us both in the treatment path and in the recovery process, and also longitudinally over kind of the scope of our lifetime. Having different resources that we can plug into will just be more supportive of how we are able to practice and relate to our practice as our body changes. So tons of resources online, tons of resources through the library in the local community. And sometimes I think it's also a matter of just reaching out. So something that I like to say, and I'll offer this invitation to each of you, is that if you're interested in speaking about yoga or meditation and you really just don't even know where to start, send me an email. I'm happy to speak with you and connect. I've got a really vast network globally of amazing practitioners around the country, around the globe, that I'd love to plug you into. And if I don't know what to look for, I'll know who to ask to help you figure out that path. So it's also about community. And sometimes when we practice, we can feel isolated, and sometimes during treatment we can feel isolated. And so that first step to reach out, Justine at justineyoga.com. You can send me an email and just say, Justine, I'm in Birmingham, or Justine, I'm in Ontario, or I'm in Portland, wherever you are. I'll know who to plug you. I will work to plug you into the right environment for you based on your needs at the time that you reach out. And if you reach out again in a year and your needs have changed, then we'll have a conversation there. But it's all about that connecting. And this is the beauty of working with a physician or a nutritionist or a teacher, is that that person is there with you on the path and able to help support and guide you through your journey, wherever you may be in that moment and over time.
Thank you. That's an amazing resource. Thank you so much. So this is directed back to Dr. Rogers. So if I'm overweight, will it make a difference if I only lose 5 or 10 pounds? Is it safe to lose weight? What is a safe amount of weight loss to plan for during treatment?
So I'll give you some general information. Now, on treatment may require some adjustment based on the type of treatment you're receiving and the recommendations of your oncology care team. So what I'm going to describe is more general recommendations for the cancer survivor. So losing as little as 5% of your current body weight can result in measurable benefits related to your blood sugar and other outcomes. This would mean, for example, if you weigh 200 pounds and you lost 10 pounds to 190 pounds, you can, physiologic benefits happen with that kind of weight loss. So even a little bit of weight loss is beneficial. And so I encourage individuals who are overweight or obese to focus on even the small goals that you achieve. We usually recommend in our own clinic that a person lose about no more than about 1 to 2 pounds a week. You can lose weight faster if you're post-treatment and you're under the care of a physician. I mean, we have people lose weight faster with bariatric surgery and some more aggressive approaches. But for most people, it's really better just to stick with, no more than about 2 pounds per week. I think this is especially important for a cancer survivor where more aggressive weight loss may trigger a negative response from your body or by increasing some inflammatory response and that kind of thing that we as scientists still don't completely understand. So I think it's important that remember the safe weight loss is about 1 to 2 pounds per week. And I strongly encourage my patients who are cancer survivors to really focus on the quality of their diet in addition to the quantity of calories that they're trying to restrict. Yeah. Thank you.
Great, thanks. And this brings us to a question for Luz that I think a lot of us get and a lot of us have about specific eating types when we're trying to lose weight, whether we're actively undergoing treatment or not. But a few things that people read about and hear about is the ketogenic diet or a macrobiotic diet, an alkaline, like an acid-based diet, an anti-inflammatory diet, eating all raw foods. Are there any benefits, risks, if I eat a specific food type like beets or aloe vera juice, will it prevent recurrence? Can you touch on that a little bit for us, Luz?
Yes, and actually it's quite a loaded question. So I'll try to break it down as well as possible. So first, let me start off with talking about a specific diet that I find can be helpful for weight loss, just because I find that some patients like to have like a name to the diet versus just general recommendations. So what a lot of oncology dietitians will recommend, whether it's for weight loss, for, prevention of other comorbidities down the line. So for example, like diabetes, and then even like during your cancer treatments, is actually the Mediterranean diet, because it really coincides very well with the American Institute for Cancer Research's guidelines, where it's primarily plant-based with a focus on lean meats, kind of the same as the other recommendations that I mentioned. Now, where it varies a little bit is that with the AICR, they recommend about like 16 to 18 ounces of red meat per week, whereas the Mediterranean diet emphasizes a couple servings per month when it comes to red meat. So they focus a lot more on seafood, poultry, very lean animal meat proteins. And on top of that, they also have a big emphasis on healthy fats. So nuts, seeds, olives, olive oil, those are just some examples, but it's very similar to the AICR recommendation. So it's something that I myself for my patients will recommend throughout the entire kind of cancer journey. And the weight loss perks for the Mediterranean diet is also backed by science. There was a study in 2016 in the journal The Lancet, and it found that the Mediterranean diet, those participants actually lost more weight than those who were like on a low-fat diet. And then in a study published in 2015 in the American Journal of Medicine, they also found that the Mediterranean diet was very effective for long-term weight loss versus going on a low-carb diet, which the Mediterranean diet actually allows for carbohydrates, but complex carbohydrates. Now, as far as these other diets that were mentioned as part of the question, like the keto diet, the alkaline diet, one thing I will say is that they may be effective for some people, but not necessarily everyone. The reason for that is it could be based strictly on a calorie deficit. However, there isn't enough research to necessarily promote these diets. So for example, just for time's sake, I'll talk about the alkaline diet because I feel that I've been getting this a lot from my patient population the last several months. With the alkaline diet, it has some good components. So it's a diet that's emphasizes fruits and vegetables. However, it's based on a theory that is just not backed by science. So the theory of the diet is that if you're consuming these fruits and veggies and eliminating entire food groups, that it will help keep your body in a more alkaline state. Now, when it comes to that portion, that's not quite true. Your lungs and your kidneys are actually responsible for keeping your body at the right pH level. And it's actually a very tight pH level. It's actually right around like 7.35 and 7.45. And if you have any variation in either direction, it can actually lead to very serious complications and serious enough for you to feel ill and actually end up going to your doctor or visiting the hospital. So when it comes to these diets, just to kind of summarize it for everyone, what I would recommend is either speaking to your oncologist, speaking to your dietitian, having an open conversation about, what may seem appealing about these diets and getting their input and getting some more information so that they can kind of help guide you towards a diet that's right for you, right for your current lifestyle, and just help you transition, a little bit easier versus trying to kind of navigate things on your own. Now, as far as very specific foods, like I believe you mentioned beets and aloe vera, the same way that I had mentioned previously, that it's not just about one specific thing for the prevention of cancer, that kind of goes for these foods too. It's more about, an overall healthy lifestyle. That's why we're here today to talk about all these different factors. So it's about a well-balanced diet in general, and not just one specific food or supplement. It's about the physical activity and the food that you're eating and your weight. So one specific item will not necessarily prevent your recurrence.
No, thank you. And I think that's sort of the purpose of this webinar, is to really address not just the actual nutrition, but the mindfulness and the physical movement. And they're all, so important. So on that note, Justine, would you lead us through a 2-minute mindfulness session?
Love to. So nice to see everyone again. I'm going to teach you a word to start out with. And I think y'all will really enjoy having this word in your toolkit. It's a Sanskrit word, and Sanskrit is the ancient language of the yogis. And this word is spelled S-V-A-H-A. And this word is swaha. Swaha. And you can hear it. It's like onomatopoeia. Swaha is basically that action of throwing something into the fire, releasing. Swaha. And I love this word because I think what it does is really sets the intention towards letting go and also simultaneously letting be. And all the current research in the space of neuroscience, and specifically in an area that I'm quite interested in called neurodharma, is showing that our ability to let go and let be allows us to come more specifically into the present moment. So not being ruminating about the past, kind of in that more depressive state, and not being super far in the future, which creates a more anxious state. Letting go and letting be allows us to be more whole and more fully in the present moment, takes us out of this really midline area of thinking and takes us into the farther reaches of the brain, the more lateral sides of the brain, having a more open and expansive experience. So swaha, you can say it whenever you need to. You just take an inhale, feel your body stretch through your toes, and swaha it out. So that's the first practice, just a little extra gift for y'all for your life, and I hope you enjoy using it. Maybe it'll be helpful in partnership or with kids or any of the daily stressors that we have related to the pandemic, related to anything going on in our lives. Swaha, letting go and letting be. The next breath practice that I'll share with y'all, I call release valve breath. And this is another breathing practice that we can do wherever we are, at any time, in any place. Release valve breath. So release valve breath, with all these meditation practices, it is really nice to be able to ground into the body, to have that somatic experience. So I like to feel the feet resting on the ground, maybe spread a little through the toes. Feel the hands, rest them on your body, either seated or standing. Make that contact with what's real, with what's present. And then it's a very simple practice. The inhale is through the nose. You don't have to force the inhale or manipulate it in any way. Feel yourself taking a full breath through the nose. Pause, and as you pause, feel the expansion of the breath in 360 degrees around your chest, the fullness of the chest. And as you're ready to exhale, softly exhale out through your mouth. So we're self-regulating, utilizing the breath, utilizing the tools of the nose and the mouth, always present with you. So we'll do it a few times. Feeling into your body, make contact with the earth through the feet. You can spread a little bit through the toes. And then feeling into your hands, make contact with your thighs through your hands. Let your shoulders relax, feel your spine lengthen. The eyes can be either open or closed. Inhale through the nose. Exhale softly out through the mouth. Inhale through the nose. Exhale softly out through the mouth. If you want to incorporate the swaha into release valve, inhale through the nose. Exhale swaha out through your mouth. We'll do that twice more. Inhale through the nose. Exhale, swaha, out through the mouth. Just taking your time, there's no rush, no one's waiting for you, moving at your own pace. Feel through your body, spread through the toes, hands making contact with the thighs, spine long, shoulders relax, back of the skull drawn back towards the wall behind you. Inhale through the nose. Exhale out through the mouth. And I love to do this release valve practice first thing in the morning. So lying in the bed, stretch through the body a little bit, feel the body wake up, do whatever feels good to you to open up and breathe. And then spread through the toes, make that contact, feel your own contact with your own body, bring yourself into presence. 5 rounds of breath. Inhale through the nose, exhale out through the mouth. You can incorporate that swaha if you like that sound a little bit more rather than just the vocalized exhale. You can do that in your car before you walk into any environment, before you walk into an appointment, before you walk into a treatment. You can do it while you're seated. Anywhere in the world, nobody even needs to know what you're doing. Just ground through your body, make contact, feel presence. Inhale through the nose, exhale through the mouth. And then one of my favorite things to do before I go to sleep at night is I keep a little tennis ball or a small little myofascial ball right beside my bed. And I like to work my feet before I go to bed at night, feel the earth, feel that connection to the feet, and then just take 5 rounds of that release valve breath right before lying down at night, letting the day go, letting everything move out, and saying, I'm about to go to sleep now. It's time to rest. Bring in peace, bring in calm, bring in that awareness of wholeness and fullness, the feeling of letting go, the feeling of letting be, and letting the day release and moving into a space of rest, a space of care. A core component of well-being is our rest. So utilizing mindfulness, utilizing breathing practices, utilizing our nutrition and our physical activity as mentioned to truly support this magical restorative process of rest. And I wish you all rest and wellness.
Thank you so much. As you can see, I've moved to my yoga mat for breathing purposes. That was amazing. I think I want to move into the last sort of 10 or 15 minutes to take this opportunity to bring all of our panelists back and to address some of the questions that have come up from the audience. One thing that's come up over and over again, and Luz, I'll direct this to you, is, and if anybody else wants to chime in about it, but the question is, what supplements, specific supplements, do you recommend post-chemotherapy?
So as far as specific supplements after chemotherapy, it's going to depend a little bit. So if it's a person who maybe really struggled with eating, potentially was, experienced some malnutrition, I definitely would be following their lab values to be assessing for any kind of vitamin mineral deficiencies. And my recommendations would actually be based on the lab values. So I don't, across the board recommend anything specifically, unless it's for my GI population that is having a total gastrectomy or a partial gastrectomy, since we have very specific guidelines for that. However, I will say if it's, a patient who's been going through radiation therapy, experiencing a lot of diarrhea, we may be monitoring a few vitamins, specifically, the fat-soluble ones like for example, vitamin D would be a big one that I usually see being a bit deficient when you're experiencing diarrhea. And then the next ones would be potentially zinc and copper, but it would really be dependent on how your course went and what your struggles were. So there isn't necessarily anything across the board that I would recommend for everyone, which is why I definitely always recommend our oncology patients who are actively receiving chemo that they do touch base with, a certified specialist in oncology, or at least a dietitian who is very familiar with the oncology population, so that they can, assess your lab values, assess how you did, and then from there evaluate what supplements would be appropriate.
Okay. And then can you explain, actually, first of all, explain to our audience if you know what Fucotin is. I think I said it right, but there was also a question about it, and if it's something that you can take while you're going through active chemotherapy.
Is it, you said Fucotin?
I think that's how you pronounce it.
Okay.
Fucoidan.
So to be quite honest, I am not familiar with the supplement. It has not been brought up to my attention. However, what I like to recommend to my patients, and it's something that I myself and other oncologists here at the University of Chicago do use. It's an app called About Herbs, and it's from the Memorial Sloan Kettering, Center, and it's free. And I like it because supplements like this that I may not know about, that maybe, the latest trend, for example, they do an amazing job of keeping it updated for both the healthcare professional and the consumer. They bring it down to very, easy to read everyday words that anybody can understand. And it will tell you the most recent data on it, whether it is something that is supported, if it's something that doesn't have trials. And then it even tells you what medications and chemos it interferes with. So definitely apologize for not knowing that one, but I really would recommend that if you are interested in learning about supplements from a reputable source, if you have an Apple phone, it's called About Herbs. For those who are on Android, you would have to go through their website only because that app is still in the process of being made, but it's reputable. And another good resource would be just talking to your oncologist and even the pharmacist. What I do here is when patients come to me with supplements that I am not aware of, I meet with the pharmacist and even talk to the oncologist to make sure that we cross-check with the chemos and medications to make sure that they're not interfering. So that's one thing that I would suggest, since I wasn't able to answer specifically about that supplement, but especially for other ones, because there will always be other supplements that come up. I really do recommend having just that open conversation with your team, because they'll be honest with you, whether this is something that they would recommend or if it's something that maybe is just once or twice a week. So definitely, reach out to your team as well.
Okay. And then this one's more towards anybody who feels like they can answer it, but is there anything that can help with post-chemo insomnia specifically? Whether that's exercise, nutrition, mindfulness?
Probably a little bit, probably all of the above.
Yeah.
Definitely exercise has been shown to improve sleep quality in cancer survivors. That's primarily aerobic, but I also know that yoga can help that as well. So Justine may have some input on that. And there are other recommendations like don't drink caffeine too close to when you go to bed and some things like that. So it can be a struggle and unsettling and definitely interfere with the quality of life. But I think there are ways you can manage that with exercise and others. But I'm sure Justine and Luz have some comments.
Do you want to go first, Justine?
Sure. I think it's a really important question. And so I just want to say I hear you and I feel you. When we have disturbed rhythms, one of the most important things we can do is recognize it and say, this is what's happening and it's really stressful, and to name it. And so I would say there is probably a psychological component to that too. And I would say if you have access to speaking with somebody about the disturbance in the rhythms, because what's happening during the day, stress is not a one-time incident, right? It's not like we get to a point and we say, oh, now I'm super stressed and I can't sleep. So usually that disturbed rhythm has been building over a period of time, and it's an aggregate experience. And then when we try to relax, there's so much going on in the mind and the body that it's actually, we're just working in overdrive to relax. And sometimes the things that we bring in may actually cause additional stress. So just really paying attention and kind of being your own best friend in that regard, trying different things, keeping a journal, noting what may or may not work. I love a gentle restorative sequence of yoga, and this book once again has some really wonderful resources. Relax and Renew. She has some wonderful restorative sequences. I use the Calm app. The Calm app has sleep stories, and there are a few sleep stories that have really brought me through some very difficult periods of life. And I don't listen to a lot of them. I found a few voices that I really resonate with, and I listen to them again and again. And I really love them. I love that practice, that release valve practice at night, and creating a nighttime ritual. So I would also have a look at your own evening ritual and your morning ritual, and noting what are the things that you do to actually prep to get to the point of sleep, and seeing if you can incorporate some more relaxing practices, if possible, losing the screen and not keeping it close by, if that's a possibility for you. Turn it off. I'm a big proponent of do not disturb. And, if there's somebody that needs to be able to get through, they're on the list, but otherwise, nothing is more important than our rest. And so having an honest look around our space, the lighting in the space, in the psychotherapy community, we also speak a lot about set and setting. And so just paying attention, what is the room that you're, trying to rest in? Are you doing a lot of other things in the bed besides resting? Or is it a designated space for rest? So there's so many different ways to look at it holistically, and to find a program that works for you is going to be very unique and may require a little bit of try and adjust. And so you are supported in that practice, and you're not alone. We really struggle with rest as a society. And so I wish you well once again in finding that path that works for you.
Yeah, I use the app Headspace, and I pretty much have started using that ever since the beginning of COVID every single night to help me go to sleep at night. You did bring up the piece about caffeine. And so several people have asked about sort of how much, not only caffeine, but how much alcohol intake is appropriate. And then several people have asked about marijuana or other types of smoking or vaping. Luz, can you kind of touch base on that for us?
Yeah, so as far as alcohol, I will say that during treatments, talk to your oncologist. They will likely ask you to not drink, especially with the chemo and your meds. Definitely ask them about that. But in terms of kind of just general recommendations for, prevention of cancers and different problems, the AICR actually recommends for women just one alcoholic drink per day. It seems low, especially on a Friday night when you're unwinding with your wine right next to you, but that is what they have found to be actually a good amount for preventative reasons. Now, the second part of the question you asked was in terms of marijuana, and I had a feeling, we just talked about this with some oncologists here, so I figured I'd pull out my little research article because in terms of research in the United States, it's been rather limited because it's been illegal, and it's still not even legal in many states. So that unfortunately has led to the studies being very limited, unfortunately. However, in the European journals, there is some research that's been coming out in the last few years. There's one specifically that we were discussing here in the European Journal of Internal Medicine. And in the study, they did find that cannabis, as a palliative treatment for cancer patients, actually seems to be well tolerated, effective, and a safe option for patients who cope with some of the symptoms. What I will say, though, is speak to your team. Make sure that this is appropriate for you, especially if you live in a state that this is legal, because there are still some big red flags, especially with, CBD oil. There's some research to show that it actually interferes with the breakdown of certain medications. So that could lead to some issues. For our elderly population, it may act as too much of a sedative. So it may be hard to, wake up in the morning. So regardless of even this article, I would say that this would merit a conversation with your team to make sure that it's appropriate for you and what you're going through at this time.
Great, thanks. And on that note, I really hope that everybody will take a moment to review the resource pages that we put together specifically for this module. And we really want to encourage you to feel free to share them with your provider and discuss how the information may be useful for your personal journey and talk about that with your personal oncologist. Lastly, I want to thank our panelists. They did a phenomenal job, and this was just a wonderful webinar. And what I would like to ask of the participants is when we finish, which will be momentarily, I'd ask that you all lie flat on a yoga mat or flat on the floor And if you can, elevate your feet for 5 minutes and just breathe. And then take a piece of paper and write down any feelings, emotions, and questions that have come up during this session, and bring those to your oncologist at your next visit. So thanks so much for joining us today.